Today, across America, insurance companies are selling mental health coverage to our people worried about their mental health or that of their loved ones. Unfortunately, too often after these insurers take big premiums from our people, they let them down. The providers they advertise aren't available. They can't get appointments. The firm basically says we aren't taking new patients, which of course was not represented to them initially in that way. The fact is, these Americans are being ripped off by what the Government Accounting Office has described as a ghost network. Not my language, the language of the Government Accountability Office. Now, to me, what a ghost network is all about is essentially selling health coverage under false pretenses, because the providers who've been advertised aren't picking up the phone, they aren't taking patients. And in any other business, if a product or service doesn't meet expectations, consumers get a refund. In my view, it's a breach of contract for insurance companies to sell their plan for thousands of dollars each month while their product is unusable due to a ghost network. And so I'm going to work with all of my colleagues here on both sides, Democratic and Republican, to get some real accountability for these patients who paid good money for mental health coverage and they find that there is very little there. And in a moment of national crisis about mental health, with the problem growing at such a rapid rate, the widespread existence of ghost networks is unacceptable. When somebody is worried about their mental health or the mental health of a loved one, it's hard to work up the courage to step up and try to coordinate their care. And if they can't get help, the last thing they need from a big insurance company is a symphony of please hold music when they call, and non-working numbers and rejection. I think we can all imagine, because we're all hearing from our constituents. I'm looking at my Republican colleagues. I've talked to almost all of them personally about this mental health challenge, and we've been working on it together. But what I've described is not a hypothetical matter. Last month, my staff conducted a secret shopper study. They made over 100 calls to make an appointment with a mental health provider for a family member with depression. And they looked at 12 Medicare Advantage insurance plans in 6 states. The results were clear. Our secret shoppers could get an appointment. Now, this is after people had paid vast sums. They could get an appointment only 18% of the time. That means more than 8 in 10 mental health providers listed in these insurance company materials were inaccurate or weren't taking appointments. A third of the time, the phone number they called was a dead end completely. In one instance, staff trying to reach a mental health provider was connected to a high school student health center. And Senator Cassidy is a real pro at all this health issue, and I think both of us would probably say we laugh, but we really feel like crying for the patients, and I think it's kind of representative, of it. By the way, in my home state, I'm not very proud of what our investigators found there too. My staff didn't find that we could make one successful appointment. Other secret shopper studies looked at commercial health insurance, found the same thing. In 2017, researchers posing as parents seeking care for a child with depression got an appointment 17% of the time. 2015, pretty much the same results. Ghost networks are an ongoing, persistent problem. The Finance Committee has been looking closely at this issue, and we put a lot of sweat equity into developing legislation to improve mental health care for all Americans, from telehealth to youth mental health to workforce to care integration and parity. And I can look down the row, starting with Senator Crapo, to my Republican colleagues, because we have been working on this in a bipartisan basis. And we've got plenty more to do, as Senator Crapo and I talk about in our weekly conversations. Finally, just looking at the ghost network issue to wrap up, it's a three-legged approach. We've got to have more oversight, greater transparency, and serious consequences for insurance companies that are fleecing American consumers. And I believe certainly greater transparency, for example, ought to be an easy one for members of this committee to get around. I don't know anything about the accountability you get with transparency being a partisan issue. So I want to work with my colleagues on that issue, on the accountability questions, and I want to look at this across the board, not just with respect to Medicare and Medicaid, and many of my colleagues have expressed interest in applying policies to commercial insurance like employer-sponsored plans. So we've got a lot of work to do. There isn't going to be anything partisan about it, and let me yield to my friend, Senator Crapo.